Well, more than 7.5 million adults in the United States live with a chronic skin disease known as psoriasis. Nearly one quarter of people with psoriasis have cases that are considered moderate to severe, and up to 90% of psoriasis patients have what's called plaque psoriasis. Plaque psoriasis can cause painful, itchy lesions on the skin that scale and flake. Yet, despite the availability of many treatment options, no single treatment works for everyone affected. Here to bring us up to date with some new developments in managing the disease are dermatologist Dr. April Armstrong and Leah Howard, President and CEO of the National Psoriasis Foundation, who also lives with psoriasis. Thank you so much for joining me today.
Thank you for having us.
Now, first, Dr. Armstrong, can you explain what psoriasis is and what the different types are?
Absolutely. Psoriasis is a chronic and a common inflammatory skin disease that can affect any part of the body. And when we look at the root cause of psoriasis, it's been found that in psoriasis patients, a part of their immune system is actually hyperactive or in overdrive. And patients with psoriasis oftentimes present with these red, scaly patches or plaques that can be on their scalp, elbows or knees, or really any part of their body. And what we see is that these patches or plaques can itch, they can be painful, and importantly, it really affects their quality of life. There are a number of different types of psoriasis. There's a type where the patient can be red from psoriasis from head to toe. And there's another type where the patient can have pustules on their skin breaking out as a type of psoriasis. But the most common type of psoriasis is plaque psoriasis, where patients will have these skin plaques, commonly on the extensor surfaces, such as the elbows and knees that I described earlier. About 80 to 90% of the patients will have this type of psoriasis.
Yes, that's something that's very unknown for sure. So thank you for bringing that information up to us. Now, tell us, what can you tell us about your personal connection to plaque psoriasis, Leah, and why have you chosen to advocate for people who are impacted?
You know, my career has really been all about speaking out on behalf of individuals impacted by different conditions. 10 years ago, when I came to the National Psoriasis Foundation, it was really exciting for me to have an opportunity to be advocating on behalf of a community that I'm actually a part of. Today, as the president and CEO of the NPF, it's really my honor to be both a voice as well as a resource for individuals living with plaque psoriasis. My own journey began more than 20 years ago. I was working full time, going to law school at night, planning a wedding under a little bit of stress, as you might imagine. And so I actually think stress was the trigger for me that really started off my disease. Today, though, for me, it's important, both for me personally as well as for the National Psoriasis Foundation, to be having conversations like this and educating individuals living with psoriatic disease about how they can get their disease well managed. So I'm happy to be here today with Dr. Armstrong in partnership with Bristol Myers Squibb to have a conversation around just that.
And we appreciate you using your platform to raise more awareness. Dr. Armstrong, tell us, what's the latest treatment available for plaque psoriasis?
The FDA recently approved a once daily pill, so it's an oral medication for adults with moderate to severe plaque psoriasis who are also candidates for systemic therapy or phototherapy. And this new oral medication is called Sotyktu or deucravacitinib. And Sotyktu, it works, has this unique mechanism action, and it's really the first in a new class of medications in psoriasis that target a different part of the immune system. And this was developed by Bristol Myers Squibb, and with whom Leah and I are partnering today. I, as a dermatologist, am particularly excited about this new medication because in the clinical trials, this new oral medication has been shown to be more effective in terms of clearing the skin of psoriasis as compared to not only placebo, but also the leading oral medication currently on the market. So this is very exciting for our patients to have this medication that has very good efficacy in the skin. Now, I also wanted to mention, as with any medication, there can be side effects. And some patients in the clinical trials experience side effects such as common cold, cold sores, or folliculitis. However, the overall discontinuation rates from the clinical trials is actually the lowest for this new oral medication compared to patients who were randomized to placebo or to the other oral medicine. So it's really important if you are a patient out there, or if you're a practitioner who are thinking about how to incorporate this new medication into your toolbox, I would encourage everyone to check out Sotyk2, that's SOTYKTU.com, to find out more information about this medication, look at the clinical data, and so forth. And for patients, it's important to talk to your healthcare providers to find out if this medication is right for you.
And in your opinion, in both of your opinion, what does a new treatment option mean for the community of people impacted by psoriasis?
Yes, so in my opinion, and I'm interested in hearing what Leah has to say as well on this, in my opinion, from the perspective of a dermatologist, for a very long time, we really haven't had a lot of new developments in the oral therapy realm. We had a lot of treatments in the biologic realm that were developed. And I feel like this is an exciting time because we have a new medicine that's not only efficacious, but also has a good safety profile, so that our patients don't have to do the trade-off between try to pick a medication that works well, but may have side effect profile that can really significantly affect them, or vice versa. So I think this is very exciting for our patients to have this new oral therapeutic option.
And I share Dr. Armstrong's enthusiasm here. I think, patients are always excited to hear that a new therapy is available. And so we encourage them to partner with their healthcare provider to find what's going to be the most appropriate treatment for them. Certainly, if they want additional resources, the National Psoriasis Foundation website is a great tool for them. That is at psoriasis.org. So we invite folks to visit that to get additional resources to better manage their disease.
Wonderful. And lastly, I just want to ask the two of you, what types of tips and advice would you like to give to those who are currently living with psoriasis, as well as their caretakers and immediate loved ones, as to things that they can do, to continue to manage the disease in an effective way?
I think one tip I oftentimes ask my patients is whenever their psoriasis is flaring, or if they get it, they think they might have psoriasis, because sometimes it's confusing for them whether they have psoriasis or not, if they're a new patient, to definitely seek out dermatologists or dermatology providers who specialize in psoriasis. And this is because we have so many different treatment options now available for psoriasis, so you definitely want to pick one that is familiar with those options. And the National Psoriasis Foundation has in their website a list of the healthcare providers who express an interest that this is their area of specialty. So I've always found that to be very helpful, and recommend my patients for that.
And I would just remind people that they're not alone. So please do seek out resources and support from our community.
Yes, absolutely. And again, that website to find out about this great new once-a-day medication to help manage psoriasis is sotyktu.com. That's SOTYKTU.com. Again, this is a brand new, exciting innovation, once-a-day oral therapy for psoriasis. Definitely check with your healthcare provider as well to see if it's right for you. I want to thank both of you so much for joining me today. It's been a pleasure. Thank you for sharing this exciting new therapy as well as resource for people with psoriasis. And Leah, again, thank you for using your voice to raise more awareness. Both of you are appreciated.
Thank you.
Thank you.